Most people here would understand what a dentist does and know that dentists deal with mouths and teeth. But I guess one of the things that makes me a little bit different is that in my role, I kind of call myself a biodentist. I'm not just your ordinary dentist in the fact that I don't just deal and I don't just treat people based on drill, fill, bill system. It's more about dealing with how the mouth can affect your entire body and all your body systems, and how that, like, people don't understand actually this, which is why I've made it my first slide, which is the mouth is actually the gateway to optimum health for your entire body. And if we don't get the mouth right, you won't get your whole body right. People have most probably heard this, right? You are what you eat. This is not entirely accurate. If for those who were at the previous talk and we had Dr. Stefani talking about skin, you also absorb quite a lot. For ladies, you've got skincare products, etc. The whole purpose of putting skincare products on your skin is to absorb them. Otherwise, you wouldn't use them. And so in reality, we are what we absorb, all right? And part of what we absorb comes from what we put in our mouth, but part of what we absorb also comes from what we put on our skin. But also, we get quite a lot of absorption, which is the part that most people miss in the mouth. So what those two things put together give us is what I call the mouth-body connection. And so, again, this is the part that most people miss. We think that if we just keep our teeth clean and we brush and floss, then our mouth is fine, and we don't connect the link for the rest of the body. So basically here we're going to go through a whole bunch of body systems and show how in the especially last 10 years, there's been so much research done, because as we delve deeper into the human body, we're starting to pick up links that we didn't know about before. So, for example, the brain. Oral bacteria and oral inflammation has now got a scientifically backed link with Alzheimer's and dementia, right? So if you have oral inflammation, if you have a poorly taken care of mouth or an inflamed mouth or gums, you have an increased risk for Alzheimer's and an increased risk for dementia. As well as that, it has now been linked to an increased risk for blood clots and stroke. They're three pretty decent things that we now have a link with just straight from the mouth. If we move to the next body system, the heart, oral inflammation has been linked, and this is a massive one. So many people miss this, but oral inflammation has now been linked to heart disease, but not just heart disease, but an increased risk of heart disease by 13.6%. Now, 13.6% doesn't sound like a lot, but if we compare it to something else that everybody knows, then you can see how much of an effect that actually is. So 13.6% is like an extra, or just a little bit higher than 10%. But if you consider the fact that someone who is classified as a heavy smoker, so over a pack a day, only raises their risk of heart disease by 6%. So when you put those statistics in together, you've got oral inflammation giving you twice the elevation risk of heart disease than a pack a day smoker, all right? Which is pretty significant. We also have research now showing that oral inflammation is linked to an increased risk of kidney failure. Now, obviously, just not brushing your teeth doesn't make you go straight from today and tomorrow I have kidney failure. It's an increased risk for people who have kidney disease for that disease to progress to kidney failure. All right. But we also now have evidence and research showing us that inflammation of your mouth and gums increases your burden on your kidneys, and therefore they're not as efficient in fighting the other things that are going on in your life. All right. We also have links to the pancreas. Oral inflammation has been shown to disrupt your blood sugar levels, and that increases your chances of getting diabetes and increases the severity and of your diabetes. So not only does it increase your risk of getting it, but if you do have diabetes, it will increase your severity of the disease. It has also now recently in the last couple of years been linked to an increased risk for pancreatic cancer. And we move on to the lungs. You can start seeing that we're getting all this research to link almost all these body systems together just from the mouth. Oral inflammation has now been shown to increase your susceptibility to pneumonia and bronchitis, and again, has been shown that it affects the severity and the duration that you have the illness once you get it. So even if you didn't get it from, let's say, not brushing your teeth, having oral inflammation will increase your severity of bronchitis or pneumonia and its duration. And then bones. This stuff's just literally the bone system. Most of this research has just come out in the last 24 months. During COVID, they did a lot of research. A lot of this stuff's coming out now, but they've now got definitive links between osteoporosis and arthritis and your oral condition and oral inflammation. So if we then keep going again, pregnancy. Oral inflammation gives us a higher risk for breast cancer, a higher risk for preterm birth, higher risk for birth defects. Men don't get out of this scot-free. We get higher risk of erectile dysfunction. And we also, with both sexes, have now got definitive links with a higher risk for infertility. So simply not having a well taken care of mouth now increases your chances of having a whole bunch of birth problems as well as infertility. And the list goes on. These are just the main systems that I'm talking about today, but there's constant research coming out to show how much the links are between everything. All right. We know, for example, in pregnancy that the link is so strong that most private obstetricians now are encouraging pregnant ladies that are seeing them to have a dental clean in their first trimester, because they've shown that just by having one clean in your first trimester professionally decreases that risk by like 60 to 70%. And so now there's this push. And yet it's not part of Medicare, but that's a totally different thing. So what we're seeing here is that basically not much of your body gets away scot-free if you have oral inflammation and oral disease. So it leads me to my next point, the mouth, which is really your gateway to absorption. All right. When we think of the mouth, we think eating and drinking. All right. But that's not the only thing that's happening in your mouth. And this is where now science is only just starting to catch up. All right. We have the oral mucosa and absorption. When you look at your skin is, depending on where you are from, different colors, but it's mostly non-red. Right? If you look inside your mouth, most of the tissue inside your mouth is red, right? Or a variation of red. And the reason why it is that color is because of the amount of blood supply you have. Right? The more blood supply and the thinner the tissue, the more you can see the oxidative blood and the more you see the pink. These two areas, sublingual, which basically means under the tongue, and gingival, which means your gums, are the two biggest areas of absorption in the top half of your body, basically. And we use this all the time. If anybody's ever had angina or you go to hospital and you got heart pain, they spray two sprays of this stuff called nitroglycerin under your tongue, and within minutes your heart pain will go away, or all your blood vessels in your entire body open up, right? And they can, save people from heart conditions using the sublingual pathway because they can get access to your bloodstream within 30 seconds, right? If you see movies and you see people snorting cocaine, one of the reasons why they snort cocaine through their nose or rub it into their gums is because it's the quickest way to get it into your bloodstream that isn't injecting, right? And so both of these pathways through your gums and under your tongue bypass all your body's defenses, all right? They're not going through your gut. If you take a vitamin D pill, only 2 to 5% of that pill actually enters your bloodstream. The rest of it gets destroyed by your stomach and your intestines. So if we can get vitamins and minerals and things being absorbed under your tongue, you get almost all of it, and within 30 seconds to a minute. That's why it's so important. But when we look at the possibilities of all this absorption and bypassing the body's defenses, it works in the opposite way around too. So if you have toxicity in the mouth, you can also absorb, like drugs, cocaine, etc. You can absorb them extremely quickly without those same systems stopping them. And so the mouth is also your gateway to disease. All right. And who here has heard of leaky gut? All right. Everybody's heard of leaky gut. Almost no one has heard of leaky gum. Watch this space. In the next 5 to 10 years, this is going to be a household name too, because we are learning now. I've known about this for years, but there's been limited research. Now the research is starting to catch up, and we're realizing that this is just as important, if not as important, as leaky gut for the same reason. With the best absorption comes the best reaction. Who's heard of anaphylaxis? Right? Yeah. You don't even need to swallow it. Right? As soon as it touches tissues in your mouth, the absorption is so quick that you get anaphylaxis sometimes just by breathing in the toxin or the thing that someone's allergic to, and it's already absorbing into the mucosa and causing an anaphylactic reaction, right? So if you can get anaphylaxis before you've even swallowed something, gives you an idea of how quick and how easy our mouth absorbs, all right? And why it's really important to be aware of what we're putting in our mouth because of how quickly and how well we absorb things. So we have the best reactions like anaphylaxis that happen in the mouth. And if we can get infiltration of nutrients like medicines and do that sublingually, we can also get a whole bunch of bacteria entering our system sublingually and through the gums. The way that leaky gum works is the same way that leaky gut works. When you get inflammation, all the pores open up, and bacteria and toxins can bypass your body's defenses and just head straight into your bloodstream. One of the things here, geographic tongue, some of you may have this, or some of you may have seen this in someone when they're talking. Not that people stick their tongues out when they talk to people generally, but I see this all the time. They call it geographic tongue because it'll be there this week and it'll be in 2 different spaces next week, and the week after that it's in a different spot, and the week after that it disappears, and then the week after that it's in a different spot again. And so they call it geographic tongue because it forms like a map and just goes all over your tongue. Geographic tongue, if you look it up on the internet, if you look it up in textbooks, if you ask your dentist, they'll tell you it's not caused by anything, there's no cure, and it doesn't do any harm. Research is catching up and actually showing that this can be one of the first signs you have a food intolerance or a chemical intolerance. So your tongue is showing you, I don't like this, based on how good your absorption is in the body and in the mouth, and it's having a chemoalkaloid reaction which lasts unpainful. There's no symptoms, you just notice it as a shape, which is why most people think that there's nothing wrong with it, right? So as I said, leaky gut and IBS, basically we get the same thing in the gums with leaky gum, gum inflammation, and general well-being and disease. If you're bypassing the body's systems and absorbing toxins through your mouth, and sometimes within seconds, you can see how easily bacteria from your mouth can travel through your entire system, through your body, and cause a whole bunch of different issues. 7 out of 10, if you go to the World Health Organization and you look up top 10 killers of human beings on the planet, 7 out of the 10 are lifestyle and diet related. All right. Of the lifestyle, 90% of lifestyle diseases are to do with diet. All right. If we transcribe that into countries like Australia, which is a Western country, they call it in the World Health Organization a high income country, okay, which means most of the population earns over $25,000 a year. High income country, right? Our lifestyle and diet related diseases are 9 out of 10, right? And the only one that isn't that is neonatal diseases, neonatal deaths, things that happen to babies before or just after they're born, is the only one on the list that is not lifestyle related. And even there's some research to suggest that maybe it's the lifestyle of the parents that can contribute it. So you can see based on what we're sharing here, how important the mouth can actually be to your general well-being and why I'm like so amped up about it, all right? If it's the gateway to disease, if it's the gateway to absorption, it's also our gateway to achieving optimal health, all right? So enough of the bad stuff about how this can affect us. What is some things that we can do starting today that we can either do ourselves, or maybe we're already doing them, but we can tell other people who have questions. How can we achieve or start to achieve optimal health simply from the mouth? This is where my talk gets semi-controversial. No, I'm joking. Because I look at things differently, and because science takes a long time to catch up with things, and then culture takes a long time to catch up with science. I mean, how long were we still telling people to smoke cigarettes when we knew cigarettes were bad, right? And so, doctors in the 70s were promoting smoking for asthma, etc. So we take a long time to catch up. And so some of the things that I'm going to be telling you on how to achieve optimal health with your mouth, other professionals may disagree, but everything that's going to be on these slides is 100% scientifically backed and evidence-based. Right? We have the science to back it up now. Number one, your toothbrush. Who uses a toothbrush? Phew, that's lucky. We don't have to have that chat. The average toothbrush is 140 to 180 bristles. Okay, that sounds like a lot, right? But there are toothbrushes out there, and they're more of the toothbrushes that I recommend, that have over 5,000 bristles in the same size. Okay, and there's even one company now that a couple of months ago released a brand new one which has over 12,000 bristles in the same head. Okay, now to put things into perspective, if you open up a dental catalogue from the 1910s or 1900s, okay, your toothbrush consisted of which timber would you like your toothbrush handle made out of and which animal hair would you like the bristles made out of, right? All of our toothbrush heads were made of animal hair, and you just picked your favourite. Do you want badger, fox, cat, whatever it was, they would make it out of animal hair, right? Animal hair is crazy thin, okay? Think about how soft your cat or your dog or your pet is, right? Animal hair is very, very thin. We've gone from that to the technology of producing nylon, which was 150 times thicker. And so all of a sudden we have a generation, a culture where we're actually doing, almost 90% of the patients that I see have some form of gum recession, some form of gum damage, some form of tooth abrasion based on toothbrushing, because we went from something super soft. I'm not saying we should go back to animal hair, but we went from something super soft to something super strong and hard. And now we have a culture of brushing with something really hard, and we need to get back to brushing with something really soft. So your standard toothbrush, 140, 180 bristles. Your bristles are about 1 to 1.5 millimeters in diameter. If you're brushing with a bristle that's got, with a head the same size with 12,000 bristles, those bristles are 0.08 of a millimeter in diameter. Super soft, basically like brushing with velvet. Okay? One of the most important things about brushing is we've got to get out of the culture and out of the stigma of brushing our teeth and think massaging our gums. If you have a look at this video here, there's less teeth brushing going on and more gum brushing, right? We're brushing in small circles, angling the toothbrush at 45 degrees to the gums, because that's what's actually going to get the bristles to swish around underneath the gum and in between the teeth, and you're actually going to clean off the plaque that we're trying to clean off, okay? If we think gum massage and angling the toothbrush more towards the gum, you can see in this video, they're not even getting the top of the tooth in this moment, right? It's all about brushing across the gum and around, doing small little circles to get a massaging effect. So if we think massaging gums instead of brushing teeth, we're automatically going to brush better and be cleaning our teeth better than we were before. Okay, so using a soft toothbrush and brushing in a different way is going to make a massive, massive difference. The next one, mouthwash. Who uses a mouthwash? A couple people use a mouthwash. I don't agree with using mouthwashes. And when I say I don't agree with using mouthwash, there's, the little asterisk next to that, right? And then you read the fine print underneath, on a daily basis as a daily regime, okay? If you think, if I look, again, we're going to look science and logic, okay? Ignore what all the marketing says. Definitely don't buy Listerine Smart Rinse for your kids, which is the artificial sweetened mouth rinse for kids that they advertise because, have good oral health for your children. It's just marketing. If you think about it from logic and from science, I'm going to say that on average, everyone in this room has a relatively good oral health, all right? We're not brushing our teeth for weeks on end and hoping for the best, right? If you could say that your mouth is in generally a good condition, then if you drop an atomic bomb in your mouth, what are you killing more of, good bacteria or bad? Yeah. Good, right? If on a daily basis you kill all of the good stuff, what does your body have to do on a daily basis? Recreate all the good stuff. And if the slate is clean, we know that we have about 14,000 different types of microbiota in the mouth. All of those have to recreate themselves and reestablish their houses every day that you use a mouthwash, and you're hoping that the good ones outdo the bad ones in that race every morning, right? So Different story if you have mouth ulcers, if you have an infection, if you have a problem, bad breath, whatever. Now the ratio is skewed. Now you've got more bad than good. Mouthwash can be beneficial, but as a daily, everyday rinse, we can be doing a lot worse than we actually are having a benefit from it. On top of that, a lot of mouthwashes in Australia still have alcohol, and there's lots of studies to show that alcohol-based products in the mouth used on a daily basis increases your risk of oral cancer by up to 30%. So not a good idea to be using that. There are alternatives to mouthwash, and we may get into that if we have some time. But another one, floss. Who flosses? Cool. I also don't like flossing. I told you this would be controversial. All right. Flossing, the American Dental Association in 2018 actually removed the statement for all of America saying that we should brush and floss our teeth on a regular basis for optimal oral health. They didn't tell anyone they did it. They just did it because they didn't want to create a big hurrah. But over the last 10 years, with all the research that we've gotten, there's basically no evidence to say that it works. Okay? Now that doesn't mean don't floss. What that means is floss the areas you need to floss. If you've got a piece of carrot or a piece of beef stuck between your teeth, floss is very helpful for getting those bits out. But if you aren't getting things stuck between that particular tooth, chances are your contacts are tight enough that you don't need to floss. Right? If I push a table up against this wall as hard as I can, and then I run a piece of string through it, and I keep doing that every day, after a month, how close is the table to the wall? It's not touching as tight as it was before because I've been running this piece of string through it. And so what we're finding is that you're actually opening the contacts of your teeth. On top of that, almost no one flosses perfectly. I can floss your teeth perfectly because I'm using two hands and you're upside down and you're in my chair, right? And I've got really good control. But when we're at home, even I can't floss properly, and we would almost always get bleeding when we floss because half of the time we're not actually getting bleeding because our gums are inflamed, but because we're cutting them, okay? Because of how thin floss is. So yes, floss has its place, but I would prefer that people use interdental cleaning. And what do I mean by interdental cleaning? There are these cool things called interproximal brushes, which are like tiny little pipe cleaners, and you pick them based on the gap between your teeth so that you're using the right size, and you use them and you go between your teeth, not between the contact. Okay, so again, if you're getting food stuck between two teeth, you need floss to get that food out. But if you're getting food stuck underneath that contact between your tooth and your gum, floss isn't going to do anything because you're hitting this side and it stays in the middle. You want a little pipe cleanery thing to be going in between there and cleaning that space. Or one of these amazing devices. Who's here have heard of water flosser? Right? Water flossers are an amazing invention. I was a hater. I thought they were a gimmick until I bought one. And now I basically advocate them to every single one of my patients. It's basically a high pressure water hose for your teeth, but it's not what you think, like, you know, peeling the paint off concrete. It's pressurized specifically for the mouth so that you don't get any bleeding. But what it does is it pushes with water all of the bacteria and plaque and food out from between your teeth and in those contacts without doing any damage, without physically moving anything. The cool thing about this, and again, this is a biohack, this is a life hack, this is not endorsed by the company at all. They even say, do not do this on the box. But I'm telling you, you can, as long as you don't mind your little blue or clear window going brown. You can put essential oils in there. You can put a little bit of mouthwash if you want. You can put warm, salty water in there and then fire it between your teeth and get an even better clean than you were before. And then on top of that, we have, as I said, there is this thing, again, slightly controversial thing that people talk about in terms of mouthwash replacements or interproximal cleaning, and that is oil pulling. Oil pulling is actually evidence-based and it has scientific backing to do. To the point where there's a study that came out of America last year showing that it statistically significantly reduced people's sinusitis and chronic sinus infections by oil pulling in the mouth. Gives you an idea of the scope of absorption we can have in the mouth by rinsing or swishing with something that absorbs toxin. You're reducing sinus infection, which is like 3 centimeters away through tissue, right? So I'm not going to go too much into that. There's plenty of resources online if you want to get into that. There's specific oils that you should use if you want to get into that, but that's, I would classify more as like an advanced technique if you want to do that, and only for people who would like to. And last but not least, toothpaste. I left this last, so in case if I run out of time, you guys can like kick me off. But basically, the reason why I put this last as well is because I wanted to give everybody a basis for why I'm putting so much emphasis on toothpaste. It's because we have this massive culture in Western culture to use toothpaste and with specific characteristics. In the late 1800s, early 1900s, there was a company called Pepsodent who employed a guy for about $1 million back then, which is approximately the equivalent of like $80 million now, to run a massive marketing campaign to sell toothpaste. And that's where we get the whole fluffy feeling on my teeth, must use toothpaste. That's where minty toothpaste comes from, frothing toothpaste comes from, white toothpaste comes from. It was all part of this marketing campaign from the early 1900s. And now, to not brush with a minty toothpaste, a frothing toothpaste, and a white toothpaste almost feels weird to us, all right? If you buy a toothpaste and it's cinnamon flavored, you're like, this is weird. If you buy a toothpaste that doesn't froth or isn't white, it feels odd to us because of how our culture has shaped the way we do things. So, I'm not going to get into this topic today. All right. If you have questions and you want to ask me about this later, I'm more than happy to answer all the questions you like. I leave that up to a personal choice for people, whether you use fluoride in your toothpaste or not. But one thing that I think is very funny to me is that most dentists and hygienists, if you're seeing them, will give you this information. Who's heard this information before? That you should spit but not rinse your toothpaste. Right? Yeah, right? It's said everywhere. Yep, you've got a bit of recession or you've got a bit of issues with decay. You should spit your toothpaste out, but don't rinse it off. In other words, if you're not rinsing off, what are you doing? Leaving it in your mouth. And what do we know about the mouth and how good it is at absorbing things? So you're absorbing things. And there's method to their madness of telling you to spit and don't rinse. They actually want you to absorb it so that you can have more of the stuff that's in the toothpaste doing stuff to your teeth and to your tissues and to your bloodstream and your saliva. However, and I've got a whole bunch of these here if you want to have a look afterwards so that you know that I'm not just fabricating this stuff and it's real, because all of these packets are here, I can't alter them. If we look at a packet, and I've specifically cut off kind of the labeling a little bit so that you can't tell as much. What does it say on the top line here not to do? If you had a super healthy toothpaste full of all natural amazingness and it was made of apples, they would tell you could swallow it. There also wouldn't be labels on there that says, which is cut off on this one, do not keep out of reach of children, if it was safe, right? We've got another one. You can probably tell the brand of this one, right? And in bold at the top, what does it say? Do not swallow it. Who still wants to spit and not rinse their toothpaste? If the actual manufacturer of the toothpaste is telling you not to let it absorb into your mouth, not to swallow it, but your oral health professional is telling you to do so. This is this is the top selling natural toothpaste in Australia, Grants, and even they say do not swallow ours, right? So I find that very, very interesting. This is, I just took a random brand of toothpaste and I've put it here. This is not to diss toothpastes, but now that we've had that conversation about how important absorption is in the mouth, now you guys get to make your own personal decision as to what you want to be absorbing every single day, twice or 3 times a day when you brush, okay? Ignoring the fluoride and everything else we have. Glycerin, unless it's stated that it's vegetable glycerin, you can basically be assured that it's made from petroleum. Hydrated silica, which is basically a fancy word for saying wet sand. We've got sodium lauryl sulfate, which is SLS, if people have heard of that before. That is a frothing agent. The only thing it's a surfactant, which froths. The only purpose it's in the toothpaste is to froth. They've taken it out of most shampoos in Australia because they found that it causes cancer, but they put it in toothpaste so you can spit and don't rinse. It's excellent. We've also got, I'm not going to go into all of this stuff, but one of the other ingredients in this toothpaste is benzyl alcohol. We know that alcohol can contribute to oral cancer, especially if used on a regular basis, and this toothpaste has alcohol in it. It's also got palaxamyl 407. Anything with numbers in it is 100% man-made, and this is one of the microplastics that this particular company puts in their toothpaste. So you're swallowing microplastics, and it's one of the ways they make it cheap. Where are we going? And the second two ingredients down the bottom, one is an artificial sweetener and the other one in there is phosphoric acid. Again, I just pulled this straight off the shelf and just took a picture of it. There's other things like Totarol, which is a cancer-causing antibacterial that's in Colgate Total, and titanium dioxide, which is in a massive lawsuit at the moment with Skittles in the United States because they found that it's poisonous, and they've been using it to whiten the inside of Skittles for years. And now they're in a massive lawsuit currently in America because obviously Skittles are marketed to children and they're slowly poisoning children with titanium dioxide. But phosphoric acid, I don't need to tell you that it's an acid. And it's one of the hardcorest acids that we can actually use, especially in the mouth. That and citric acid are the two worst acids you can put in your mouth because whether it's in a basic environment, neutral environment, or acidic environment, it is dissolving your teeth. So you have a toothpaste straight off the rack that has alcohol, cancer-causing agent, and acid in it. So I don't tell people you shouldn't use this or you should use this. The whole purpose of this talk is to inform you so that you can start your journey on having optimal health and decide what you want to be brushing with, what you want to be cleaning with, and how you can take care of your mouth so that you can have better oral health, but also general health. The most important thing, the most important takeaway message from this is not, oh my gosh, toothpaste is evil. It's the fact that by cleaning our teeth and keeping our gums and our teeth healthy, we are actually decreasing our risks for diseases and illnesses in almost every body system in your entire body. The mouth is linked to everything. So just by keeping this area clean, you're helping your entire general well-being. And that's why I put that yours can start today, because you can leave today and you can, make a decision that I'm going to do something a little bit differently, or I'm going to take a little bit more control over how I clean my mouth and my teeth. So yeah, thanks very much, guys.